exercise, and diet. On 88.5 Soufriere FM, tell a friend, call your neighbor. Casualty 911 is on.
This is what we say again. Good morning. Welcome inside another edition of Casualty 9 for today. 22nd of April, boys. Slowly saying goodbye to April, eh? Soon we're gonna be ushering what May.
Me.
Why? I tell you why. Imagine that. Anyway, Fawn is here with me. Let's say good morning to Fawn along with the guests. A shout out to all you guys on Facebook, YouTube, and all radio land as well, eh? Hey, good morning.
Good morning, Erlen. Good morning to all of our regular listeners and those joining us for the first time. It's always a pleasure to have you with us on Casualty 911. I am Ford Minviel with the Bureau of Health Education in the Ministry of Health. And today, I don't think we're going to waste too much time. We'll get straight into the topic. We have a very special guest with us this morning, and we have a topic that I think it is quite complicated. I think a lot of people would like to know a lot more about it, and our guest is going to break it down for us as much as possible. So, good morning to Dr. Cooper. I'm going to introduce Dr. Aretha Cooper. Dr. Aretha Cooper is joining us this morning. She is an associate clinical psychologist and infant and early childhood development specialist working in private practice. She was born in St. Lucia and spent her formative years prior to university right here. She holds a bachelor's degree in psychology from the University College London in the United Kingdom and a master's degree in clinical psychology from Loyola College in Maryland in the United States.
Yeah, boy, Fawn, have your files.
In 2019, she obtained a second master's degree in infant and early childhood development. 4 years later, in August of 2023, she completed her doctoral studies and was awarded a doctorate in infant and early childhood development with an emphasis in infant mental health and developmental disorders. She is currently the leading expert on autism intervention in St. Lucia. She also has special interests in language disorders, specific learning disabilities, anxiety disorders, early childhood education, play-based interventions, and infant mental health. Dr. Cooper is very passionate about advocacy in the areas of early childhood development and education, as well as infant mental health. Dr. Cooper has recently been appointed as chairperson of the advisory committee to the National Association of Early Childhood Practitioners. And on that note, I would like to bid a very special welcome to Dr. Aretha Cooper. Thank you so much for joining us on Casualty 911, Soufriere FM.
Good morning. Thank you for having me. Can you hear me?
Yes, we can hear you clearly.
Okay, great. I'm not familiar with this platform. I'm happy to be here to have a discussion, answer listeners' questions, educate the public on autism. This month is Autism Awareness Month, the month of April. It's something I know a lot about, I'm passionate about. I work with children with autism on a weekly basis and have done so for the past 15 or so years. So yeah, happy to be here.
Wonderful. So, Dr. Cooper, I think we can start off by you explaining to us a bit what exactly is autism, because we hear the word autism and immediately certain things come to our minds as the general public without the expertise that you have. So, for example, you might see a child behaving in some ways that may not be the social norm, and you say, maybe that child is autistic. So, could you explain to us what autism is all about?
Sure, and I would expect some of the things that come to mind, sometimes it's quite negative things.
Exactly.
And for some people, they might some positive things might come to mind, like children who have very special skills or talents in particular areas. Some people, when they hear autism, think of that. And in some ways, that represents the full spectrum of autism, some extreme, unusual skills and some more severe differences that they might have compared to typically developing children. Autism is called a neurodevelopmental disorder. Neuro refers to the brain, and it's a disorder, not a disease. And it's developmental, which means you're not exactly born with it. It's something that emerges over time. So as infants, we're born with certain skills, being able to breathe and see, most of us, and we have certain capacities when we're born, but certain things emerge over time, like the ability to speak and walk and interact. And autism affects the brain and how the brain functions. And in particular, and it affects every child differently, but in particular, it affects their ability to use language for communication purposes and to relate to people in a socially acceptable way. And also for most children with autism, how we process different types of sensory information. Sensory meaning touch, taste, smell, movement. And it's called autism spectrum disorder officially. There used to be subcategories of it, and now we just refer to it as autism or autism spectrum disorder. And so knowing a child has autism can tell you a little bit about what difficulties they may have, but it doesn't tell you exactly how it presents in a particular child.
Okay, so you spoke about it being a disorder and not a disease. Would you like to explain further so our public could have a better idea?
Sure. So disorders refer to differences in functioning. So if your ability to do something or your capacity to do something is way outside what's considered normal or typical, then they refer to that as a disorder. So there are a range of mental, developmental disorders. It doesn't, and disorders are usually detected through behavioral observations, what you can see, not typically like a blood test or some kind of scan. And how we diagnose autism it cannot be diagnosed directly with a specific medical test. It's through observations we make and taking the history of how the child was developing, what skills they demonstrate, what skills they find difficult. So that's kind of the difference. A disease has more a biological basis and a clear pathology and path, whereas the disorders tend to be more variable and has to do more with functioning, not so much differences in brain structure or yeah, I will leave it at that. If I say more, I might confuse people more.
Okay. So you mentioned the term autism spectrum disorder. So, and you also said that it has to do with the levels of functioning. So could you explain to us what are there specific levels of functioning? Is it something where one child may be diagnosed with autism and very different from another child? In what ways would they be so very different? Are there some that are easily detectable and some that are not so easily detectable? Signs and symptoms.
Yes. So when we talk about functioning, we talk about skills. What skills can you demonstrate? So an area of functioning, for example, is communication. And we communicate in different ways through words and language, but also we communicate through our body language, our actions, our facial expressions, the tone of our voice. There are various ways we communicate, and all of that together helps us send messages between people. So almost all children with autism have some level of difficulty in their communication. So in psychology, in medicine, when we refer to normal, we typically refer to what most people are doing. And there is a range of normal, right? Not everybody, for example, starts to speak at exactly the same age. But most children would start using their first words by around 12 months or a year. Most children with autism start speaking late, and the types of words that they say tend to be or can be unusual. For example, learning letters, numbers, and color names before learning the name, saying mommy or daddy. Now, any example I give of what most children with autism do or what we typically see in their history does not mean that if your child didn't do that, they don't have autism. It also doesn't mean that they have autism. We don't look at just one particular symptom. We look at all the information in totality and the pattern of behaviors that we see. So when I talk about function, it's their communication, motor skills, fine motor, gross motor skills. Lots of children with autism can have problems with their coordination. How we process sound and sight. Some children with autism are oversensitive to sound. Some of them are undersensitive to sound. Other areas of functioning, how we socialize with people, knowing to say hello, responding when people ask you questions, knowing how to behave in different social situations, knowing that when I'm on the bus, I whisper and I don't talk about home business. And when I'm in church, I have to be quiet. When I'm at school, I have to speak up. So there are these social skills that nobody specifically teaches us, but they're more intuitive and most children acquire naturally, that a lot of children with autism have difficulty with. And I mean, children in the first 5 years of their life are learning lots of skills, and there are children who have language delays that don't have autism. So again, when people are listening out for the difficulties, it's really for a professional. These are just things that can indicate a developmental disorder, maybe autism, but it doesn't mean if your child does or doesn't do that particular thing, they do or do not have it.
So, Doc, I know in the age of Google, many of us go to Google and we type in signs and symptoms and so on. So, as a parent, probably being exposed or having heard some of the challenges that autistic children may have, and for example, you have a child at home and you have noticed certain things, what would you advise a parent to do?
So that's a good question. The purpose of that information available to the public, the signs and symptoms, red flags, what to look out for, those kinds of things, is to go to get further specialist assessment. I think what we tend to do is at that stage kind of rule out a diagnosis or think, oh yes, they're doing all of that, so they definitely have it. They're not doing that, so they definitely don't. As a parent, even if you happened to be an autism specialist, you wouldn't be the right person to diagnose your own child. In the same way, if you were a medical doctor, you really should take your child to a doctor if you're suspecting a particular illness. So the purpose of that information is to bring awareness to parents as to what to look out for. And if you see any of the red flags or possible symptoms, to go on to a specialist. In St. Lucia, you can do a range of things. You can go to make sure your child gets screened at the health center. Screening for autism starts at 18 months, and most health centers have a nurse who's trained to screen, not assess or diagnose. There's a difference between that. Screening is more general, and it's designed to capture many children that may have difficulties, but it cannot tell you if it's definite. And then the health center would refer you, if your child is under 5, to the Child Development and Guidance Center, or they may want you to see the community pediatrician who visits all the health regions at least once a month. Or you can go directly to your pediatrician and say, oh, I Googled this and I've been concerned and here's what I see happening. What do you think? Now the pediatricians are able to screen and assess for autism. If they're unsure, they still have the capacity to refer to Child Development and Guidance Center. In the case of autism, it's really important to get screening, assessment, and intervention as early as possible. And as early as possible, we like it to be as soon as you think there's a concern, rather than a wait and see approach, because it makes a difference how much we're able to help the child the sooner we meet them and get to know them and start intervention specific to their needs.
Okay, so how much does age really matter when it comes to the screening, the evaluation, the diagnosis? Because
It's
you find
extremely
our
important.
oh, I was about to say that in our culture we do have, as you said, that wait and see attitude. So we would wait, because we would say, every child develops differently and does things at a different age. So maybe I should just wait and
And
see
some
what.
people will say, why are you calling that on the child? Why are you asking for that? Leave the child alone, let them develop. And I understand that, and we're not the only country or place in the world that feels that way. Like, why are you looking for problems? And it's not for the sake of labeling the child, or um, it's not the case of looking for problems. It's because if we identify differences, these kinds of differences very early on, it makes a big difference. So me as an autism intervention specialist, I like to get children before 2.5 for sure, even better before 2, because the type of change that can happen in the brain between 2 and 3 is much greater than the change between 3 and 4. As human beings, we are special in that our brains we can learn for our entire life. And they call it neuroplasticity, so plastic, like bendable, moldable, but we cannot learn at the same rate throughout our entire life. And something special happens when children are under 5, and especially when they're under 3, is that their brain is still being constructed. The networks in their brain, those pathways between the parts of the brain responsible for language and social skills and math, reasoning, and communication, and their motor skills and fine motor skills, those pathways are trying to get connected, very well connected to each other. So that kind of construction that's happening in the brain doesn't happen in the same way after 5 years old. And that's why it matters that we see them really early. Just same way, if we think about people who learned an instrument, for example, when they were young versus when they were older. The reason is the older you get in, you're laying down more pathways responsible for creating music, like playing the piano or learning to play the violin, or even learning a language. These things can happen much more rapidly and comprehensively, and those skills get very well consolidated when you're very, very young. And it's not because we want to call anything on children or label them. We have no control over whether a child has autism, neither does a parent. But we do have control over the types of things that we can do in the environment to shape the brain.
So when we speak about the parents' ability to accept, of late, well, it has been quite a while. Well, but of late, let me start by saying this. Of late, we
Mm-hmm.
have been hearing a lot more about autism. It almost seems as if we are saying that there are more autistic children now than there were before. So let us start there. And then the other
Mm-hmm.
thing I would like to bring up is that parents seem to often be very reluctant. Number one, for the evaluation, then they have difficulty accepting a diagnosis, and that would also pro- um, have challenges in terms of whether they actually follow through with the recommendations or the treatment. So could you speak to that, please?
Okay, so firstly, it is correct that the proportion or the percentage of children with autism um, versus without in St. Lucia and almost every country in the entire world is greater. I think for when I checked a few weeks ago in the US, it was 1 in 36 children are diagnosed with autism. And only a few years before that, it was 1 in 48. And a few years before that, it was 1 in 64. So the number of children is increasing. We also are better. We detected earlier. We're raising awareness, and more parents and professionals are able to identify autism. And I think in terms of parents' acceptance, that's related very much to the society, because we're all part of society. And if a just like HIV was in the 80s and 90s. If a condition, disease, disorder is heavily stigmatized, you would understand that people would have a lot of fear about facing it because they don't feel that they know all the implications when a society is not accepting of them and their child and their family. So when I speak to parents, their fears are sometimes legitimate because they get verbally abused in public, they get stares, people call them bad mothers, people say their children have no manners, they get told that it's their fault if they didn't do this, if they didn't do that. So if you feel that that's what you're going to receive, or you on disclosing the diagnosis to family members, friends, you get a negative response, then it makes you want to stay away. So we are all responsible. I won't point a finger at parents. We're all responsible for educating ourselves more about the condition, and destigmatizing it, so that when a parent gets this news, which is generally not received well, obviously, because there's a lot of unknowns, and it's parents' ability to receive the information, like I say, is dependent on how accepting they feel it would be. So it goes hand in hand. We both have, all of us, each of us has a role to play in helping parents accept a diagnosis and supporting them once they receive the diagnosis with real tangible support, because there's a lot of fatigue, that compassion fatigue and burnout that parents experience when they have to care for a child with autism.
Of course, again, if you want to make a contribution, you can call us right here at 459-7885 or 459-7888. Remember, you can also send us a WhatsApp at 730-5388, and of course, Facebook. Yeah. All right. We're talking about autism this morning.
Wonderful. So, Doc, thank you for that explanation. It puts a lot into perspective. Now, I want to go back a little bit to the proportions and to ask you whether we have any idea why we are seeing that increased proportion of children with autism. Are there certain risk factors that are more common now that that have created that situation?
Yes, so there's no one answer to why, but it's better that we speak about it, like you say, in terms of risk factors. Now, people have a little bit of trouble understanding what a risk factor really means, because they look at one case or two cases and say, well, for example, prematurity is a risk factor for developmental disorders in general, not just autism. So, but we're talking about autism. So a baby being born before full term, 37 weeks, increases the risk that they will later be diagnosed with autism. So when I state a fact like that, people will say, oh, but my child was born at 36 weeks, 35 weeks, 28 weeks, and they don't have autism. Yes, because it's about a proportion. So if the risk, I'm just throwing out a percentage here. Please do not quote me on the percentage. This is about the purpose of education. Let's say, or the risk for anything specifically is 10%. That means the risk for not getting it is 90%. So there will be some people, 9 out of 10 people or 90%, who will not get the condition when you look at a group. So we don't apply risk to individuals. It's when we look at large groups of people and we have to separate who went on to get autism and who didn't go on to get autism. Those who were born premature are more likely to have autism. Those whose parents are older, both the mother and the father, increase
Doc,
the risk.
when we say older, what age are we looking at?
Just at every point, just generally older, but advanced maternal age is a risk factor for the.
Yes,
Sorry.
that's what I was thinking, that advanced maternal age usually begins at about 35. So
Right.
would that be
so certainly that, but just being older in general. So if you plot age against autism, the older the parent, the more likely you are to have autism. Both the mother and the father. If you have a family member, a first degree relative who has autism, like a cousin, a brother, a sister, or you have a brother whose child has autism, then it's more likely that the child, your sibling, would be born with autism. Your child would be born with autism. So all of these are risk factors, and risk factors are cumulative. So the more risk factors you have, the more likely. I don't know how helpful that information is for people when they're trying to make a decision about having a child, because these are things you can't control. You can't control, well, you can try to do the best you can in terms of maintaining your health, but we have no direct control about whether our child is born premature or not. Some people are trying for many years to have a child, and it finally happens maybe a little bit later than they originally liked. That's not something they have direct control over. So knowing that information, I'm not sure if it would change many people's minds about when they or if they decide. If you have one child with autism, you're more likely to have another child with autism, because there is a hereditary component to autism.
Okay, so somebody's making a contribution. Somebody's asking, are the vaccines that the babies get a risk factor for autism?
No. The short answer to that is no. That has been circulating for many decades now, that vaccines, particularly the MMR vaccine, increases the risk of autism or causes autism. But that was based on some faulty research and data that has been debunked.
Yes.
And so that is not a fact. There are plenty of children here who don't get vaccinated and they go on to have a diagnosis of autism as well. So it is definitely not causal, and it's not a known risk factor either, or there's no evidence to support that.
Doc, are there any environmental factors? You spoke about the risk factors that we have no control over. Are there any environmental factors that might contribute to the development of the disorder?
So when we talk about environmental factors, there's the biological environment in which the child is developing in before they're born, and then once they are born. So stress in any way, whether it's biological stress or psychological stress, is not good for a developing fetus. So it's quite important for you to take care of your mental health and your physical health just in general. Things like medical conditions or complications in pregnancy also increase risk factors. So gestational diabetes, preeclampsia, all those sorts of things increase kind of stress on the body and would be a risk factor. In terms of external environment, again, stress, anything that would create stress in a household is not good for the developing brain or the developing child. So abusive situations, in terms of the environment, and like nutrition, eating a healthy diet is important for the developing brain. We cannot pinpoint things specific to autism, but you want to stay as healthy as possibly mentally. You want to have good emotional and family support during pregnancy, after birth. A lot of mothers suffer from prenatal depression, for example, and the people around them don't even realize that's what's going on. So stress is an environmental risk factor, and I would say that is something that's more prevalent now in our culture than maybe decades before.
Okay. So let us go back to, we did diagnosis, screening, evaluation, and the diagnosis. What is the diagnostic process like? How is a child diagnosed with autism?
So there are various tools at CDGC. We have a range of tools that we use, but the younger the child, it's through observation, but it's a structured observation schedule. So you would come, you meet the family, and a very important part of any behavioral disorder diagnosis is taking a full family history. So you want to know as much as you can about the mother and father's side of the family and all the medical or developmental history, who had illnesses and who experienced maybe similar difficulties, learning delays, etc. And then you want to know the medical history and what the child's milestones. You would collect a lot of information about when the child did what, and what behaviors started to present themselves when. And then after that, we would do with the parent in the room, set specific tasks, and we observe how the child responds to the task. So things you look for early on in order to help you make a diagnosis are the child's ability to use eye contact to communicate. Not to make eye contact in general. That's the thing that confuses people, because most children with autism can make eye contact. All children with autism make eye contact at some point. It's just when, and being able to use it to communicate. Children, very young children, if you notice, they're not pointing. They never, or they started pointing late. They weren't using pointing as a means for communication. We would play with them and see how they interact with them, how they respond to verbal versus non-verbal information, like actions, facial expressions, looking for different sensory behaviors. So we have a protocol of specific things we look for, and we would note how the child is performing on those tasks. And we understand that obviously when children come and they meet strangers, sometimes they're shy, sometimes they're reluctant, and parents sometimes say, well, it's because they don't know you, or it's because they've never seen that toy before. But when over your career, you've seen thousands of children, you have your clinical skills allow you to differentiate between certain things. And it's very important what the parents say happens at home. What happens at home and what happens in the clinic gives us an idea of the range of the child's functioning. And it's the full range we're looking at to make a diagnosis, not just what's happening in the room, or not just what's happening in school, or just what's happening at home. It's what's happening everywhere. I want all of that information, and I will weigh it appropriately and make a diagnosis. Most autism diagnoses are pretty easy to make for people who have the right skills. It's rare for us to not know kind of pretty quickly that's what's going on.
So it would be very important also for honesty on the part of parents in terms of what they relay as happens at home.
Parents are generally, you'd be surprised, people are pretty straightforward about what's happening and what's not happening. Sometimes there's a little bit of resistance about what it means, the significance of something presenting a behavior or the absence of a behavior. But generally, parents just tell you the truth.
Wonderful.
You know,
so
they have their children's interests at heart, so they're usually not withholding information. Yeah.
You mentioned CDGC, so could you just tell us what CDGC is for those people who may not be familiar with it?
Right. Although it's been around for a long time, it's still maybe not widely known. It stands for the Child Development and Guidance Center. I think this year would be 26 years since it was founded. Yes, as a nonprofit. So we work in collaboration with the Ministry of Health and Education, but they are, I say we, I used to work there for a long time. They're an independent, non-governmental organization. So they serve as the assessment hub or center for children with all disabilities, delays, disorders, both physical, developmental, and developmental. So currently it's headed by Dr. Kim Gardner. She's the director and pediatrician. And that's the referral endpoint for children who come through the national system, the community health center. So all children are usually checked at 6 weeks, 8 months, 18 months, 3 to 3.5 years, 5 to 5.5 years. These are the developmental points. If you see the nurse in between, they can still do developmental surveillance, which means checking on what your child is doing, the difficulty, or if they're having any difficulties doing things that would typically be expected for a child their age. If the nurse has concerns, there's specific screenings that they perform, ask you questions, ask the child to do certain things. If they have concerns, they refer you directly to the center. Right now, it usually takes between 3 and 5 months to get an initial appointment because they're serving the entire island. And then you would come for an initial consultation with one of the therapists and Dr. Gardner. And then they will tell you if they can make a diagnosis on that day, they will. If it's for autism, usually the diagnosis is done on the same day. If we're not sure, we don't say, we'll come and assess you again, and then you come back for intervention. That could be group, it could be to see the speech and language therapist, it could be to see the play therapist.
Okay. So I myself have been to CDGC. I had my son late and there was some concern about certain delays. So I've been there myself and I just want people to know that it's a very welcoming space. We actually did not have to do any intervention. It was a false alarm, but it's a very welcoming space. So I'm urging all those who need to go there to just know that you'll be welcomed and everything is well set in place, very friendly, very, very professional.
Yeah, kid size furniture. It's a good. It's well resourced, with highly qualified folks. And I'm glad you shared that, because not all children, especially, they also have a premature. There's a program for the premature children. So any child born premature in any of the St. Lucian hospitals should be referred to CDGC for surveillance and monitoring. Just because prematurity, like I said, is a risk factor, it doesn't mean most of those children go on to be just fine. But we want to make sure if there is some divergence happening, we kind of catch it early, because the chances of that becoming a more severe issue goes up if you don't do anything about it early on.
Exactly.
So a lot of people with a newborn sometimes are reluctant to come. It's like, my baby's just born, give them a chance. But it's only for monitoring purposes.
Okay. Thank you. We have a question from a listener. A listener is asking whether a child can grow out of autism.
That's a very good question. So it depends on what you mean by grow out. So technically, if you have autism, you always have autism, because it's, like I said, neurodevelopmental, and your brain is wired in a particular way, and that fundamentally you can't completely change that. But there are children who make so much progress, and especially when they get early intervention, and even sometimes without early intervention, that you sort of cannot tell. It's difficult to tell. Now, sometimes it depends on the domain where they are, what environment they're in. So it might not be obvious in school or obvious for people that don't know them, but when it comes to maybe more intimate relationships, making friendships, the autism, the deficits that come with their autism might show up differently and more severely in certain relationships and in different environments. For example, school, family, it's one thing. People they don't know, it's something else. So there are people who no longer meet criteria. Like if you had to look for the observations, they're not showing any of those deficits anymore. But that's not so common.
Okay. Even with treatment?
Yeah, even with treatment, to not be presenting at all, that's rare. I haven't come across, I know that it exists in the literature, but in all my years of working, I haven't met a child who just did not appear to have any of the symptoms or challenges anymore. But it's an interesting conversation, because it's like I say, autism is not a disease. So we're not really trying to make the child not themselves, or to cure it or remove it from them. We're trying, because every child is unique, and we all have talents, we all have things that we find harder. And for children with autism, language and interacting with people is one of those things. And we want them society is structured in a certain way, education systems are structured in a certain way, and we want them to be able to get along better, function better, be happy, be more comfortable. For example, if a child has a sensory overload, we want to be able to address that so that they can have more fun when they're out and about and not feel so overstimulated that they always have to leave. We're not trying to fix them. We're trying to help them adapt by learning certain skills, and in some cases, changing how their brain processes information, adapt to the environment in the world as it currently exists. Some parents tell me, the stimming, the repetitive things that kids do sometimes can be really irritating, constant humming or spinning, and it can be difficult to tolerate it. And they want me to make the child stop. But sometimes stimming is what makes the child feel calm. So it's a balance. Every child lives in a family, and not everything is easy for other family members to be able to accept. So we're always trying to work to not just the child, but with the whole family, and see kind of the best fit. And then the family, of course, is in society. So we're trying to find a good fit between the family and the current school that they go to. Sometimes it's a bad fit and they have to move schools. Sometimes one family member doesn't feel so capable of coping with certain things, but they can help with one aspect, but not with the other. Everybody has to be taken into consideration.
We have another question from a listener, and then I will come to my question. The listener is asking, in all of the screening, evaluation, diagnosis, treatment, is the child, him or herself, aware that they're autistic and what it means to be autistic?
When I work with the little ones, no. Even children who have typical intelligence, they might start to get an inkling that they're sort of different in some way. But as soon as a child is older, because there are children right now who would have been diagnosed and their parents obviously know, and then they go along, maybe they're in the regular school system, but their parents never told them. They're just starting to experience themselves differently. They're having trouble making friends. People are acting strangely towards them or saying mean things to them, and they don't really know why. My particular point of view is that as soon as a child has the emotional and intellectual capacity to understand difference and have a conversation around how we interact and relate and treat each other, I encourage parents to tell the child. For a lot of people, they think knowing something like that, again, always because of the stigma. Like, why would I do that? Because then they'll feel, I don't want other people to know. I don't want them to know. But you'll be surprised how relieved people can be when there's okay, I'm different because of this. You're different because of that. I'm short, you're tall. I'm very good at math, and I have autism, and sometimes I don't like these noises, and I'm all these things. I'm not just autistic. Autistic is just a part of who I am. It's not everything that I am. So children, and some children will never really have that awareness because their intellectual or language ability doesn't allow them to understand that kind of information.
Okay. I hope that answers the question for you, listener.
Sorry, I don't know if I did a good job answering.
I'm sure you did. So I'm hoping that the listener caught on to what you were saying. Doc, what does maybe you cannot give I'll ask the question anyway. What does treatment typically look like?
That's a very good question. So when I was at CDGC and even now in private practice, if the child is very young, that's a really good question. Treatment is not what people think it is. I think when people think of therapy, they think their closest point of reference is kind of school and schoolwork and maybe paper-based things and activities and worksheets, and I don't know. It seems like it's more teacher and school-based. That's what people have in mind. So if a child, it very much depends. If a child is of normal intelligence and they can follow what an adult wants them to do some of the time, they might go straight on to speech and language therapy, and the therapist might sit with them and do some specific activities, give them instructions, play games, model good language for them, make them do tasks that challenge and but we always have to assess first, right? So therapy and assessment go hand in hand. Where are you at exactly? Where's the gap? And therapy is about filling whatever gap I identify. If a child is very young and non-verbal, so they're not using words as their main form of communication, they have trouble understanding, they have trouble sitting, they're jumping around, spinning, very active, a lot of sensory overload. I do something called DIR floor time therapy, which is very play-based kind of work, very much trying to connect with what are the child's interests and needs. It's all about relating, getting them interested in me. A lot of children with autism initially are not very interested in other people. They're more interested in objects and how the world works, or they're very taken away mentally with meeting certain physical sensations like exploring sounds, sights, touching things, moving their body. So if they're at a very sensory stage, that's where we start. If their sensory is okay and it's more that they cannot relate, they're not looking at me, they're not responding to me, they're not interested, then I'm working on getting them more interested in the interaction. The foundation of being able to communicate is first calm and being able to pay attention to another person, then to be able to engage in some kind of back and forth with another person, and then using language. A lot of parents, he's not talking, it's only speech, even though the child is autistic, and they want to start working on the talking. And even speech therapy doesn't just focus on the production of words, because there are plenty of children with autism who can say lots of things, but they're not very good communicators. And they're not communicators because they don't know how to interact. They don't know the rules of interaction, like looking, waiting, taking turns, nodding. You're automatically following the rules of interaction with me. Nobody had to teach you exactly how to do that. And children with autism, we have to kind of show them how to wait, how to look, how to interpret tone of voice, how to use their face. So that's where we start. And then we layer language work on top of that. So thank you for that question.
Okay. Doc, there's a term that you have used quite a few times during the discussion. You say sensory overload. So what does that mean?
Okay, so all of us have sensory preferences, right? Even if your vision is 20/20, your hearing is normal, we might have certain preferences. So let's take vision, for example. Some people love bright colors and patterns. They find it very stimulating. They find it interesting. If they had a very plain house or plain clothing, they'll be bored and find it hard to pay attention. They'd always want to add, I need to decorate, I need to do this. So their vision is fine, but they have a preference for highly bright colors, contrasting colors. Some people might like more neutrals. So that's a sensory preference. Now, if a person who has a sensory preference for neutral spaces comes into a very bright, or somebody buys them a very busy outfit, they're not going to like it. They're going to avoid it. They'll never wear the outfits. They find it overstimulating. They don't want to look at it, and vice versa. So we all have sensory preferences, but children with autism can be at the extreme end of certain things. Sound is a very common one. So the hearing is just fine, but it's what the brain is doing with the information after it hears it. So you never go to a party and you see this, as soon as you come in, it's so loud and the people there seem fine, like it's not bothering them, but for you, it would be too much. Yes, it's loud, but you cannot tolerate the loudness. Whereas the other people, it's loud for them too, but they can tolerate it. So sensory processing is about our tolerance for different types of stimulation. And the tolerance is what the brain does with the information after. Because we're perceiving things. I'm looking at a bright orange wall right now. If I cannot tolerate it, I'll turn and look away. And children with autism are not always good about knowing what to do to get away from things that they find annoying. And they don't know how to communicate. Like another one is clothing. A lot of them are very oversensitive to the texture of clothes. So it's finding they're taking off their clothes. They don't want to wear shoes. That's the reason a lot of children with autism toe walk. Nothing wrong with their legs or their muscles, nothing. They just cannot tolerate all these different textures and sensations coming through their feet. They don't know what to do with the information. So I work a lot with that, how to increase their tolerance, learning what their preference is so we can avoid things or sometimes seek different things out. Like some of them love to move. It seems like no amount of moving ever satisfies them. These kinds of things. Does that make any sense? I don't know if I was...
That was a very good explanation because you broke it down. I learned a lot because I just thought that sensory overload basically was that, okay, maybe as you mentioned the sound, so then they would act out. But I did not know about sensory preferences and the level of tolerance and all of that. So it was a very good explanation.
Yeah, we all have the sensory preferences, just not to the extreme. And we are better typically developing people are better at knowing how to adapt to their sensory preferences. You know, you just wouldn't put on the shirt. But if you're little and you can't say to mommy, ouch, then you kind of stuck having to tolerate something that's intolerable to you, what would that make you do? Try and rip off the shirt in the middle of somewhere, you know? The behaviors might look out and inappropriate, but they're trying to solve a problem that they don't have the skills to solve on their own.
Or to communicate how exactly it's affecting.
Right, help me, or what? Because the parent might not even realize it's because of the tag, or even the smell of things. That's another reason why many children with autism are picky eaters. The smell, the taste, the touch. We're eating with all our senses, not just taste and eyes.
Wonderful. Thank you, Doc. We have another question from a listener. And the listener is asking whether it's possible to misdiagnose autism, misdiagnose bipolar disorder as autism.
That's a good question. Okay, misdiagnosis in general, yes. Sometimes we get it wrong. Very rarely, but sometimes we do get it wrong. And it might be the two most common things that might get misdiagnosed in young children of autism might be ADHD and a speech sound disorder. Sometimes children are so unclear with their speech, and it creates all sorts of other difficulties. Because once you take communication out of the equation, you could get behavior problems, you could get inattention. And so these, if we do make a misdiagnosis, sometimes it's those two other things going on. Bipolar disorder, that question, because I am primarily specialized in dealing with very young children, I'm not a child and adolescent psychiatrist. So where the overlap in older children with bipolar and autism happens, that would be a better question for a child and adolescent psychiatrist, which we do have a great one on island, Dr. Shani Venner. I'm going to ask her that question. I need to know the answer, but I don't know.
Okay, thank you, Doc. Now, Doc, the time is going by so quickly, but I'm having so much fun. I wish I could keep you here for the entire morning, but I know I can't. So I'm going to ask you how we can best support children with autism and parents of children with autism within our early childhood education centers, our schools, the higher levels, and in public generally. How can we support them?
Okay, that's another great question. So let's take early childhood. At that age, children, of course, very dependent on their families. So we support very young children, the children preschool age, by supporting their families, by withholding judgment. Some of us, we feel, you know, like you say, we've Googled some stuff and we know all about autism, or we know what the parent is doing. I mean, parenting is extremely hard. Anybody who's a parent knows how difficult it is to, you know, instill values, try to not damage your children, try to meet all their needs. And the last thing any mother needs from you is judgment, you know. If there's curiosity, ask questions, try to find out information, come at the family with open-heartedness and not judgment and criticism, and ask what you can do. If you see a child in the supermarket tantruming, maybe say to the mother, is there any way I can help you? Not what's wrong with him, why he's doing that, why you don't beat him. You know, these are the kinds of ways we feel we have a right to throw that kind of conversation to other people, because we have judged them and feel they're doing something wrong. And by criticizing them, somehow we feel like we're helping. Ask. If you don't have anything good to say, then just step away. Don't just silent, or offer help, offer support. You know, is there something I can do to help? Can I hold this for you? While, you know, sometimes children are having meltdowns in public. And if you don't know what to do, better to not do anything. Families, I think programs like this really help educate the public, so we realize, I want to say, autism is not the fault of anybody. It doesn't matter what you think. The person could be generally, in your assessment, not a great parent. They still didn't cause their child to have autism. Just like nobody causes any developmental disorder. So we don't have that right to lay judgment on them. Early, as soon as you suspect that there's a difficulty, reach out to whatever help you can get. So that's CDGC for under 5. There's a special education unit of the Ministry of Education, which is responsible for providing support services to children who are in school from primary all the way up to A level. So you would reach out to them. Each primary school or infant school has access to a special education teacher. That's the person you want to talk to if you feel your child is undiagnosed or they are diagnosed and their needs aren't being met. What other level? So these are the 2 units responsible: CDGC for under 5s and special education for school-age children.
Are those referrals required for CDGC and
No, that's a good thing. You can just call. You can just call as a parent. You cannot refer somebody else's child without their permission, right? We're not going to see a child without the parent's consent. But usually what can happen is, let's say that the principal, the administrator of a preschool might talk to the parent, and the parent gives them permission to call and make the referral, but it's only after they've spoken to the parent. So you can't just do it sideways, because we're not going to call people up and surprise them and say, hey, by the way, so-and-so thought you should come and see us. But a parent can call. If you see the pediatrician, they will call us directly. The nurse will call us directly with the parents, always with the parents' permission.
Okay, thank you, Doc. So, Dr. Cooper, I think that you did an excellent job. I hope we can have you back on the program at some point. And I believe that our listeners learned quite a bit. It's very informative, very clear, and excellent altogether. You broke it down very well. I learned a lot myself, and I'm sure that the public learned a lot. I'm not sure if we have any more questions. Ellen, do we have any more questions? Okay, we have no more questions at the moment, but thank you to our listeners for asking those questions. I think it helped the doc to explain a little bit more on things that may be of concern to many people. So thank you for that. And
thank you so much. Really, really great questions from the audience and from you. Very good questions. So thank you for the opportunity to get into the meat of some of the topics a little more than, because this is a longer program, so it's nice to be able to talk in a bit more depth.
Yes, thank you so much, Dr. Cooper. I'm just so happy. I'm just so happy that you made it onto the program and it went so well. I cannot think of anybody listening to the program and not having learned something.
Well, wonderful. We met our objective then.
Excellent. Thank you so much. Have a wonderful day.
Thank you for having me. Bye-bye.
Health is not merely the absence of diseases. It is your social, economic, physical, spiritual, and mental well-being. Just imagine if you're on 88.5 Soufriere FM talking